Hi, my name is Christine. I received a kidney from my brother Rich. When I was 3 years old, I was diagnosed with Wilms tumor, which is a form of childhood kidney cancer. I had surgery to remove the kidney and the tumor, followed by radiation and chemotherapy. The treatments were successful. The cancer never came back. And I had a pretty normal childhood after that. But by the time I was in high school, my remaining kidney showed signs of trouble. By the time I was in college, it had become much worse. I was hospitalized a couple of times. I had terrible headaches, extremely high blood pressure. I was tired all the time. Typical signs of kidney failure. They attributed my kidney failure to the radiation and treatments that I had as a toddler to treat the cancer in my other kidney. Living with kidney failure in my early 20s was hard. Fortunately, I had some wonderful doctors that helped me to manage the disease and the symptoms long enough so that I could finish school. I graduated at the end of May, and a few weeks later I began dialysis 3 days a week. Not exactly how I had hoped to spend the summer after my senior year in college, but this was my reality, and I was very, very fortunate to be surrounded by a wonderful circle of family and friends that helped keep me positive and motivated and comforted during the process. So as I look back at this time when I was in my late teens and early 20s, I recall that my nephrologist talked to me and my mom and explained that there was a chance or even a likelihood that I would need a kidney transplant at some point in the future. Maybe it was my young age or the fact that I was really focused on finishing school, but I don't think I realized how soon this would become a reality. Fortunately for me, my brothers and my mom had already had a conversation about my situation, and they all decided that if the need became necessary, they would be tested to become an organ donor for me. I'm the youngest. I'm the only girl, and I'm the little sister. And some of you might relate to this, but my brothers have pretty much tried to protect me my whole life. So I think that this act of generosity of talking to my mom and making this decision without talking to me was another way that they protected me. They wanted to lift the burden from me and make the decision for me so that I wouldn't have to face the stress and the anxiety of it all. And for this, I am most eternally grateful. So it was probably in early 1990 that I learned that I would need a kidney transplant sooner rather than later. And my family, who, as I've told you already, discussed this with each other, approached me and all offered to be tested to become a kidney donor. The list of emotions I felt at that time is long. I felt, of course, intense gratitude, love, comfort, knowing that so many people were willing to offer to help me. But I also felt some anger and guilt because I hated the fact that I needed their help in this way. I couldn't comprehend how I could ever repay such a gesture. And it was a really emotional but beautiful time. So on the morning of surgery, my brother and I were both wheeled together into the pre-op area and placed next to each other so that we could be together and talk. And I remember that we were both a little bit anxious. And I remember that well, but I apparently don't remember all of it because, according to my brother, when they gave us medications in our IVs to relax us, mine worked so well that I fell asleep. So I don't remember much after that moment. The next thing I remember is waking up in post-op, and everything went well, and the rest is history. So my transplant was in 1990, and at the time, I believe patients stayed in the hospital much longer than they do today. So both my brother and I, after surgery, were in the hospital for about a week. My room was on a different floor than his, but I remember that the Sunday after surgery, we I was well enough to be wheeled to his room so that we could watch football on television because his favorite team is the Chicago Bears and they happened to be on that Sunday. So that's how we spent the Sunday after my transplant. I recovered from the transplant very well. As soon as I recovered from surgery, I immediately felt better than I had in a very long time. I don't think I realized how sick I had been for years. And so I was thrilled to have a new level of energy and grateful beyond belief that I didn't have to go back to dialysis. So it's been 28 and a half years since my brother gave me his kidney in 1990. I'm doing very well, as is he, and organ donation works. So the relationship that I have with my brother Rich, my donor, is wonderful. We will always have a special bond because of the kidney transplant. The anniversary of the transplant every year is a special day that we mark either by having dinner or even just a phone call, but it is a very important day for both of us. For our 20th anniversary, my husband and I threw a party and invited our closest friends and celebrated my brother and the gift of organ donation, and it was just wonderful. For the 25th anniversary, we went fishing with my brother to northern Wisconsin because it's one of his favorite things to do. So this is a day that has become more important than birthdays or any other day in the year. This truly is a special, special day in my life. So I've learned a lot. As a practical matter, I've learned that there's life after kidney failure and that organ donation works. And I've learned the importance of follow-up care, to follow up regularly with, in my case, I have a transplant nephrologist that makes sure that that we keep track of any long-term effects of years of immunosuppression, especially skin cancer. I've had a number of skin cancers, so I see a dermatologist every 3 months like clockwork, and she helps to keep those under control. And I've learned the importance of taking medication faithfully. These medications may have unpleasant side effects, but they keep us healthy, and that is very important. Big picture stuff. I've met some amazing people in the transplant community, both kidney organ recipients that have become dear friends of mine, and donor families, and donors, and living donors, and they all bring joy to my life. So it's really nearly impossible to thank my brother properly for giving me one of his kidneys. What a gift. I have a wonderful life, good health, a wonderful husband, a career, and opportunities that I wouldn't have had if this wasn't made possible by him. So thank you, Rich. It's given me perspective. I truly do appreciate each day, and I do my best to live a good life and be a good example for others. Thank you, Rich. I love you.